This is the hsCRP Insights for Healthcare Professionals Vodcast series, brought to you by the American Heart Association, Lifelong Learning. Listen, learn, and increase your knowledge on hsCRP and systemic inflammation.
Hello, I'm Michael Garshik, a cardiologist at NYU, and for this section of Driving Awareness and Education around high-sensitivity C-reactive protein, I'll be discussing pharmacologic interventions. These are my disclosures. So we've known for quite some time that inflammation in the immune system is intimately involved in the pathogenesis of atherosclerosis and atherothrombosis. Now, traditionally, we've targeted many different processes along this causal pathway of atherosclerosis, such as dyslipidemia, hypertension, and even antiplatelet therapy. However, targeting inflammation is much more nuanced. This slide highlights many of the pathways we could target. Yet today, I'll be highlighting the inflammasome signaling pathway, which includes that IL-1 beta to IL-6 to CRP pathway. So despite inflammation being causal in atherosclerosis, we've never really had proven anti-inflammatory strategies. Now that all changed with CANTOS. So CANTOS randomized 10,000 individuals who had a CRP greater than 2 to targeting the inflammasome pathway was an IL-1 beta inhibitor. And it showed a 15% relative risk reduction in cardiovascular events, highlighting that targeting the immune system works to reduce cardiovascular disease. In fact, the greater the reduction you got in inflammation, whether it's with achieving an on-treatment reductions in CRP or reducing IL-6, the greater the cardiovascular outcome benefit. For example, in those who achieve successful lowering of IL-6, which is again driven by IL-1 beta, you had a 36% reduction in cardiovascular events. However, targeting inflammation is complex. For example, observational studies had suggested that in those autoimmune patients who had required methotrexate, they had reductions in cardiovascular disease. So CERT asked the question, does targeting inflammation via giving patients methotrexate reduce cardiovascular disease in those high cardiovascular risk patients without an autoimmune condition? And this was a negative trial, and the answer was no. So in the setting of both these positive clinical trials like CANTOS, negative ones such as CERT, we've had a series of clinical trials using anti-inflammatory medication colchicine, where in the clinical trial of DOCO2, of patients with stable coronary artery disease, individuals were randomized to low-dose colchicine and placebo, and colchicine reduced cardiovascular events by approximately 30%. So more recently, and now generating a lot of interest and discussion, are the results of Clear Synergy, which again studied low-dose colchicine, but this time in the setting of an acute MI. So in almost 7,000 individuals followed over time, no benefit was observed with low-dose colchicine. Now, as CRP was reduced in the colchicine group when compared to placebo, inflammation wasn't fully. So how does colchicine work? Well, we traditionally think of it as inhibiting microtubules, but there's also inhibitors of inflammasome activation as well. It impacts neutrophil function, neutrophil platelet interaction, all helping to reduce the risk of atherothrombotic events. In some clinical trials, you can see a similar benefit from adding colchicine, as that was also absorbed in some of our lipid-lowering therapies. Is colchicine safe? Well, it can cause, of course, GI upset. However, importantly, it's considered very safe as long as you have normal renal and liver function. You do want to make sure that you're not on any conflicting medications. And of course, if you get any issues such as reductions in your white blood cell counts, reductions in your GFR, well, then you should stop it at that point. So colchicine is just one potential option for targeting inflammation, but there are many others on the horizon. For example, ZEUS is a clinical trial exploring inflammation with an IL-6 inhibitor in those with chronic kidney disease. And this is phase 2 data from RESCUE showing that targeting IL-6 was very effective at reducing CRP. We're also testing IL-6 inhibition in acute MIs with studies such as Artemis. And we're also, because of the interaction between systemic inflammation and heart failure preserved EF, targeting IL-6 with IL-6 inhibitors, again, trying to test the hypothesis of targeting the inflammasome pathway can reduce cardiovascular disease, but this time in the setting of heart failure. So in summary, interventions targeting inflammation are being evaluated, and many more are coming and are on the horizon. Thank you.
Novo Nordisk is a proud sponsor of the American Heart Association's hsCRP and Systemic Inflammation Awareness and Education Initiative. The views and opinions in this activity are those of the speakers and reflect the synthesis of science. Content should not be considered as the official policy of the AHA. To get additional information, please visit learn.heart.org for more education. Thank you and have a great day.